My name is Dr. James Chappius. I'm an orthopedic spine surgeon and founder of Spine Center Atlanta. Our next patient that we're about to operate on is a patient who's had a disc herniation in her lower back. She was treated by another surgeon outside the Atlanta area with what's called a dorsal column stimulator, which really didn't work and is really not indicated for the type of problem that she has. So a number of weeks ago we removed that device, and now we'll be operating on her today to actually remove the painful disc and do an operation called an anterior lumbar interbody fusion. And it's actually the operation that Tiger Woods had this past year. He had 3 or 4 operations through his back and then subsequently had this operation, and he's back playing PGA golf. We're not unique in the anterior lumbar interbody fusion. Probably a third of lumbar fusions in the U.S. are done through an anterior approach or an approach through the abdomen.
That's going to be your band that has your name and then your date of birth, if you can verify that for me.
5683. My name is Elizabeth Sebring. I am originally from a small town in South Carolina, Dacusville, and I moved to Savannah, Georgia, where I met my husband, and I've had 2 beautiful children who are my life. Dr. Chappius told me about another surgery that he wanted to perform from looking at my scans, and the doctors in Savannah tried to say there was nothing wrong, but he knew immediately, and he scheduled a new surgery, like fusing your vertebrae together in the back. So I'm hopeful for it, I really am.
This space and then recreate her normal lordosis in her spine. What's unique about what we're doing here is we're doing this as an outpatient or a 23-hour stay. Most of these patients are done at a hospital setting and kept for at least 3 to 5 days. And what we've accomplished here, again with the help of Dr. Pham and her nursing team, is we're able to do this operation outpatient, observe them for 23 hours, and they're discharged home the next day. We've probably done as many of this procedure as anyone else in the country. It's an extremely successful operation, and we probably do 6 to 8 of these per month now, and the results are phenomenal. One of the other things that I've seen over the years with spine problems and chronic pain is it doesn't just affect the patient. It impacts the family, the patient's spouse or partner. It affects their work, it affects their financial aspects. And so as we're treating a patient, by enabling them to get back to a useful and meaningful lifestyle, we're helping not just the patient, but their family.
All last summer I was stuck in bed, couldn't do anything with my children, but I have hope that it's going to, we've already booked Disney for my kids this year, and that's something I couldn't have done last year. And now I can be the mom I want to be to my children and the wife I want to be.
This is not something that can be done alone. It takes a team, a highly qualified team like we have, to treat patients with complex spinal disorders. What we've developed at Spine Center Atlanta is a comprehensive spine center of excellence. And what makes me happy each day is that we can take patients that are in pain, help them get back to a useful life. I'm honored, I'm grateful, and I'm humbled each day when I come to work and I see the staff we have and the outcomes that we're getting. So it's really by God's grace and the company I keep that I'm able to do what we're doing today.